CFS, or the Chemotherapy Foundation, is a long-standing meeting that's actually been part of the meeting landscape of oncology for close to 40 to 50 years. It's really been around for quite a bit. And really what we try to do in the meeting is tell people about the most current research themes with a clinical application in oncology for that year. And looking forward to, it's a very forward-thinking meeting as well. I think anybody with an interest in oncology, it could be anybody, really. Medical oncologists, surgical oncologists, radiation therapists, nurses interested in oncology, nurse practitioners, patients, patient advocates. I think people who really with an interest in oncology and seeing where it's going to be going for the next several years, I think it's really an important place for them to be if they could make it. What really sets this meeting apart from others is that A, it's been around for quite a long time, and B, there really tends to try to be a real emphasis on what is really the most hot topics in oncology clinically and where they're going. In other words, things you really can use in your practice tomorrow and things maybe that you can use in your practice in the next year. Again, both as a surgical, medical, radiation therapist, nurse practitioner, nurse, whoever really who has an interest in oncology and its treatment. I think really the emphasis on the cutting edge things is really a fascinating part of this meeting. I think discussion of some of the most cutting edge topics, I as a breast cancer oncologist, am very interested to see where we're going with immunotherapy for breast cancer. I think that the fascinating thing is you go to last year's meeting in 2017 and you see all this immunotherapy for all these other tumors and how well it's doing, as well as some of the molecular classification that we've had in brain tumors, for example. It's really, really exciting. And I think the application of a lot of that, hopefully to my area of specialty, breast cancer, is what I'm most interested in hearing this year. I think the attendees should look forward to groundbreaking work that hopefully can be applied to your practice that year as soon as you leave the meeting. That New York City is a really neat place to go to a meeting, that it's a meeting in which you really will, I think, hopefully take home things that you could use in your practice the following weekend. Or the following week, excuse me. Take home in your practice the following week. Gotcha. I think what we're trying to do in this meeting is have more clinical crossfires. That is where a group of experts really takes both sides of a controversial position in oncology and oncologic practice, where you get to hear both sides. We had a few of those last year. I think one of the things we're going to try and emphasize this year is have more of those. The hot topics are immunotherapy, I think is a very hot topic. I think molecular analysis of tumors and what you do with them, I think is a very hot topic. The CFS is important because it really is doing what Ezra Greenspan and the people who founded CFS many years ago set out to do, which is provide a forum where it's really a summary of what's happening in oncology for that year. And I think it's a very important meeting to go to for that reason.